So Karis Neighbour Scheme, it has a history of 30 years, so it's a long-standing history. And I'll just tell you a bit about that background at the beginning. So myself and two other doctors of a Christian faith back in the 80s had a vision for whole person healthcare based on the biblical view of wholeness. And we learned about it and we wondered how on earth you could make it happen in reality. So we teamed up together. Eventually, after some years, landed up together in the same practice in a deprived area of Birmingham. And we started trying to care for people in a general practice setting in a holistic way as we could. We rapidly realized there were needs which we couldn't meet, and there were other needs which could not be met by any of the statutory services, indeed. They fell between all the gaps of the social health and the nursing fabrics. And we realized also there were communities of faith, there were churches in the community that wanted to meet needs and had resources. And so we tried to connect those two by referring individuals to individual people that we knew. And that didn't work. That felt unsafe and not a sustainable model. So we felt we needed to set up a bridging organization. So apparently your church is called Bridge Church. Well, this is a bridge in Lincolnshire. This is a bridge in Birmingham between the needs that came to light in the GP setting and the resources which existed in the community through churches. And we began to network with lots of churches, and we were struck by the question that triggered the story of the Good Samaritan that we all know so well. The question to Jesus was who is, the man said to Jesus rather, who is my neighbour? And we felt that would typify what we were seeking to do, to create good neighbours. We didn't use the term connectors, but who is a neighbour? So Karis Neighbour Scheme was born. Charis was the name and is the name of the medical practice that we're in, charis being the Greek word for grace. So Karis Neighbour Scheme was birthed towards the end of the last century. And I just want to run through what's on our website, but we have 4 missional objectives: to provide support to people in our community who are in need of offering a broad range of help, including practical and emotional support, advocacy and befriending. So on the practical side, we would often have home groups from churches that would decorate or transform a garden to help a needy person, move in and live there safely with either themselves or with their children. So there's a lot of practical work that goes on. Secondly, bring people in our community together by reaching out, offering friendship, providing opportunity to get to know one another, enabling people to be good neighbours, to help other people to flourish. So we've heard the importance of volunteering and giving already. Ensure no one is neglected or forgotten about by standing with people, helping them find the support they need and responding to gaps in provision locally. And of course, that means a lot of networking. And then working with other groups and organisations in our community across the city to strengthen networks of support, which contribute to seeing lives and communities change for the better. So some individual lives can be transformed, but also we believe that communities can be transformed by this way of working. And our values, again, we are a faith-based organisation of values based on the Bible and the person of Jesus. We're passionate about grace, that's what charis means, the giving and receiving them, and loving kindness and acceptance underpins all our work. Our vision for wholeness for people means being well in their whole person, physically, materially, emotionally, socially, and spiritually. We show compassion, acceptance to everyone we meet. We journey with people. That's a really important word, to journey with people. And we've heard that already in Lincolnshire, journey with people to help them flourish. We help build hope, resilience, and identity. And we're person-centered, recognizing the value of every individual. People are often not valued at all, but to see that each person made in the image of God is unique is very important. So that means taking an asset-based approach. And that's an important thing that I learned in my medical journey, because I wasn't taught that at medical school. I was sort of focusing on problems, but there's so many strengths that are existing in individuals and in communities that we can help people lay hold of, helping people achieve their potential and encourage people to think how they can contribute to the lives of others. And meeting unmet needs while using our resources wisely, working closely with statutory and voluntary organisations and faith communities. And finally, we rely on committed volunteers whom we value and support as they care for others. We have about 80 to 100 volunteers, many of those from local churches, but a good number from people who've been helped and now really want to help and contribute, which is a truly wonderful and part of their journey towards healing. And some of the stories that you could tell you, people who've come from war-torn places across the world who have nothing when they get to this country, and years later they're volunteering and helping and really committed to support people who also newly arrived. So here we are in part of Birmingham, and our core area is about 90,000 people in the areas of Ladywood, North Edgbaston and Harborne, if that means anything to you. What is our impact? Well, there are 4 areas of activity I want to talk about, befriending and community being first. So we work a lot with children and families, and these are our stats from 2024. We'll produce the latest version shortly for 25. These are people, newly arrived people, and in the background is the beautiful Birmingham Botanical Gardens, for whom we have a special relationship and we can use their facilities very cheaply. And these are some of the numbers of figures that we've seen of people, families that we've helped in the year. Those are people that are eligible to food voucher and food bank, are also eligible to receive support in the baby bank. And we give away a lot of equipment to people who are utterly destitute. I can tell you stories of patients I know who have come from overseas, had traumatic experiences, coming through from Africa somewhere, found themselves pregnant due to rape, and a baby arrives and they're utterly destitute. And here we have the opportunity to give them a brand new start in life and support them very practically as well as in other ways. Again, making friendships, and these are some of the feedback. You probably get the sense that we get quite hot on data, and that's really important part of proving your value, and certainly when you're interacting with funding people and stuff in the statutory services. So a lot of people feel really valued. They feel more hopeful, and they have more meaning in their life, which we've heard already is vital to their well-being and longevity. And the befriending work is the work with the older people. A lot of isolated, lonely people in our societies, particularly amongst the elderly. And we don't believe in a value of doing things to people, but rather supporting people to care for each other. So it's very much about connecting and drawing out skills and resources and the compassion that exists within older people to care for themselves. And Time for Tea is, as it says, an afternoon event where we meet new people. We have what we call a senior life group, which is linked to one of our churches. It's like a home group where people explore all sorts of important things to do with their life, their values, their hopes, their fears. And for some people, we've had stories of those years before they passed away were the most fulfilling and happy years of their life, being part of this community. Again, this is part of our work with elder people, and the percentage of people that really feel that they've connected, they've had friendship, they feel a sense of belonging, and relationships has been built. And again, some more stats about how they've participated, they've contributed, they've discovered what's important, they've enjoyed doing things with other people. More recently, we've had funding for a project with men. I've always had a concern for older men's mental well-being. It's pretty grim. In a city like Birmingham, many isolated men, and the men are even worse than women in asking for help. They won't ask for help. And so to actively engage men, this happens to be younger men, but we work a lot with people over 55 actually, and table tennis, connection gardening, a variety of things that men do together, and in that way they build back some relationships. Community advice in a deprived area like ours is vital. And we support people. It used to be more on the phone, now it's sitting on a computer, trying to help people fight the system, get the benefits that they are due, tell them what they are due, and then make sure they get it and support them through it. And the figure that always astounds me is that in our population of 90,000 that we dealt with, in 2024, we managed to achieve from the benefit system £2.3 million in financial gains. So this was money which was due to people, which they were not getting, but just through our advocacy service, we help them. And there's a lot of evidence about poverty and well-being. So we're helping people lift people out of poverty by getting what they're due. And listening guidance is a service provided by chaplains. very close to my heart. We have seen the need for providing spiritual care in general practice, and this is one of our chaplains working in my medical centre. And these are some of the figures from the 2024. You'll see that they are, a lot of people come with a variety of things. They very rarely come with a religious need or reflection. It's more life has fallen apart, lost, lonely, confused, can't make sense of life, not suitable for CBT as such. They would need someone to truly listen to them and value them, and we're able to support them and pray with them if that's appropriate, discuss spiritual factors and so on as that is appropriate for them. And the Warwick and Edinburgh Wellbeing Scale is something you can look up, but it has a 14 scale, which is a very well-being focus. It's not an illness focus, and how people feel about their life. Apparently 70% of us will fit between 42 and 60 in the scoring system. Most people who come to us, you see, are 35.8. They're well below, which means they are at risk of serious depression and mental illness. And in the time that we see them, they move right back up into that normal range and a point of 9 increased points. Sorry to be statistical here, but the scale is set that if you move up by 3 points, that is a significant improvement. So we're seeing a significant improvement in people's well-being through this chaplaincy service. And these are figures which you feedback regularly to the NHS commissioners, who are very impressed with what we're doing. And social prescribing, you've heard that. We had Karis Neighbour Scheme appoints our social prescriber, who works right across our PCN. And those are some of the figures of what we did in 2024. This has included a proactive project where we used the medical centre data, and we contacted people with dementia and their carers and said, can we support you in any way? Are you aware of what's available for you? And that was really appreciated. We're currently working similarly with people with persistent pain and talking to them and seeing how we can help them get more active, more mobile, go to maybe specific courses, help them understand their pain. So social prescribing is a key thing. That's a term which, has been around for maybe 8 years, 10 years, probably no more. But I would argue that the whole of Karis Neighbour Scheme, right from its outset, was a social prescribing organisation. It connects people with medical needs into the much wider resource of needs. Nearly there. These are just some figures from my manager, who is great at collecting data, gives you an idea of our ethnicity, about a third white, about a third black, and then a third Asian or other. So wide range of ethnicities in our area. The figure that keeps surprising me is there are 11,500 individual contacts in 1 year. So how have we all done that? Well, it's through relationships, it's through networking. And here's just some of the organizations that we network with. You see in the blue box there's the Mental Health Foundation Trust. And then down below you see the Birmingham City Council. So some of our funding comes from there. We have commissioners through that. There's a group of churches working together on that Body, Mind and Spirit partnership, and they receive money from the council and pass it on to other organizations. And a number of churches here, and other trusts and third sector organizations. So that gives you an idea of the range of people that we partner with whom we have relationships with, in order to achieve this health creation and community transformation through Karis Neighbour Scheme.